To measure wrist adduction or ulnar deviation range of motion using a goniometer, the patient is seated with the shoulder in 90 degrees of abduction. The elbow is flexed 90 degrees and the forearm is pronated. The upper extremity is supported on the table with the wrist and hand in a neutral position. During the measurement, the axis of the goniometer is placed over the capitate bone. The stationary arm is aligned with the dorsal midline of the forearm and the lateral epicondyle of the humerus, and the moving arm is aligned with the dorsal midline of the third metacarpal.
Mr. Jones, I'm going to measure how much you can move your wrist using this tool. When I ask you to, I want you to move your hand this way and hold it there. Now move your hand out, hold it there,